Hey there, and welcome to this episode of the OncoPT podcast. Now, in today's episode, we're going to do something a little different, something we haven't done in a while. So, as you may or may not be aware, the September 30th deadline for the ABPTS Oncology applications is just around the corner. And I've been getting a bunch of different questions from different people who are in, various stages of writing their case report. Now, let me be clear. This episode is not going to shame you in any way of if you have started your case report, if you have finished your case report, or if you are like, oh, that case report, I forgot about that. There is no shame here, okay? We are here to answer your burning questions that you have sent my way, and we are going to talk all about how you can, even today, the day that you are listening to this in, September 2023, you totally have the time it takes to crank out a really great case report that is totally worthy of being accepted on the first try. So, without further ado, let's dive into these really cool questions that y'all have submitted, and I'm going to answer right now. So I've compiled them, but I really don't have an answer formulated, so you are going to very much get my off the cuff, this is my gut reaction to those questions right here on air, which is pretty fun. So first and foremost, do I need to have my case report finished by the September 30th deadline or just the application? Fabulous question. So if you have already looked at the case report, you have looked at the ABPTS Oncology application, you may have an idea of this, but let me be abundantly clear for this. If you are trying to sit for the 2024 Oncology Specialty Certification Exam, the last deadline to submit both your application and the case report is September 30th. You have to submit both when you apply in order to sit for whatever that next cycle of the exam is. That is something that is a little different than some of the other specialties within ABPTS, but oncology, the case report is absolutely part of it. You have to submit it. One of the other things that I think people sometimes forget about is the experience hours. So if you have not done a residency, which I am in this camp that we're talking about right now, I did not do a residency. I had 2,000 hours of experience in specialty practice, aka oncology. And so that's what I used to, again, support that I should sit for the exam, right? That's part of the application requirements. If you are in this camp, you do have to also, in addition to the application, in addition to the case report, you also have to have those hours submitted. And remember, those hours do have to be approved, which I think I actually have perfect. This question here. So someone reached out to me, and this is a really good question, so thank you so much for asking this. Someone reached out and asked the question of, what if I no longer work for insert company here, where I got some of my hours as part of my, specialty application process? Not to worry. So what I would recommend first and foremost is start that process right now. As in, you need to reach out to that supervisor or whatever that person is in order for them to sign off on your hours. Now, what I would recommend is this. Go to the ABPTS application, fill it out, whatever you need to do. The application itself doesn't take that long. I do have a tutorial that I will link to in the show notes if you want to go ahead and view that. But at some point, you're going to finish the application, and then there's going to be a section where you will input your actual oncology hours experience into that section. From there, you will then have an opportunity to list the contact information of the person who would be able to sign off on your hours. Again, I worked at one place while I was doing all of those specialty hours, so for me it was very straightforward. That may not be the case for you, and that's okay. There are spaces where you will do multiples of different personnel to sign off on. Not a big deal. So what you'll do is you'll input that information, input their contact information, and then it's going to be like submit for request or something, where that will actually then be sent to that person's email for them to check off on and say, yes, I attest to this person getting this number of hours while I was, overseeing them in whatever capacity. I would not leave it at that, regardless of if you're working at that institution anymore or not. Because as we know, sometimes email gets lost in the cracks or lost in the spam filters. And we want to make sure that that person absolutely knows to expect that email and to be on the lookout for that email. So what I would do in this case is, first, if I was still working at this institution, I would send my employer supervisor a quick email or even give them a phone call and say, hey, this should be coming to your email inbox soon. I need you to have this signed by insert deadline that you want here. Definitely don't do September 30th. I would give them like 3 days to take care of this, and then at that point follow up with them again. That's what I would do if I was still working at that institution. If I was not working at that institution, I would really, really encourage you, send off that request just like we talked about. I would actually phone call first and foremost, because again, when you can phone call to a place where you're no longer working, you can at least get the confirmation of you spoke to a human being, whether that was that supervisor or somebody else at that company, to where you can say, I definitely spoke with this person, and I would go ahead and just like jot that down. Like, who did you speak to? When did you speak to them? At what time did you speak with them? Ideally, you can get a hold of your supervisor, whoever that was, to then say, hey, here's what to expect in your inbox. I need you to complete that in the next 3 days. I think 3 days is a really nice round number when it comes to deadlines, so that's the reason I'm using 3 days. Hey, I need you to do this in 3 days. Here's what it's going to look like. It's going to be an email. If you will please, check that and attest to that, I would greatly appreciate it. I need it for my board certification application. Great. So in 3 days, you'll be able to then follow up and say like, hey, did you do that or not, kind of deal. I do believe that on your application within the ABPTS website, you can check to see if those hours have been attested to by that person. So I would go into my application, check that, and if I don't have that, guess what? It's another phone call. At this point, I would also go ahead and send them an email, because now you've got a paper trail. And I've got the verbal confirmation of the phone call that I spent with whoever I was speaking to. It may not be a bad idea to send an email from the start, but with the phone call also, if you are not currently at that institution. The more points of contact that you can basically like lay out and put into practice, the better off you're going to be, because you have multiple, frankly, like, it's not annoying, but multiple reminders for that person of, hey, you really need to get this done for me. If you have issues with that, I do think there is a space in your application. Like, if you are bumping up, you cannot get a hold of that person, they're not doing what you've asked them to do regarding the attestation of your hours, there is a space, I believe, in the application where you can put a reason why these hours won't be attested. I've personally never come across that personally in any of the students that I've worked with up to this point. But I do think that is an option if you're in a situation where like maybe things ended really, really badly at your last place of employment, and that person is no longer there. Maybe, like, God forbid, that company went under and they're no longer in existence, right? There are some opportunities for a little bit of flexibility, but I would really, really encourage you, try to avoid that at all costs, because I don't actually know what that process is. And it's kind of a great wide, like, black hole of I don't know what could happen. So I would really encourage you, try to avoid that as much as possible. Try out the different methods. Like I said, multiple points of contact, give them a very specific deadline by which you need that information, and then keep checking that application to make sure that they did actually, attest to those hours. Next question. How do I make sure my patient case is best for my case report? Ooh, this is a good one. So how do you select from the different patient cases that I know you've encountered during your time as an OncoPT to ultimately write the strongest case report? Short answer first, and then I'm going to give you a long answer. Short answer. What case best shows off your stuff? What case is a really good example of you showing up fully, intentionally as a physical therapist who is an expert or emerging expert in oncology physical therapy for your patient? it's not even necessarily the most exotic diagnosis or set of impairments for this patient. However, if you are working with a patient who is super boring, and I say that lovingly because it's not the patient who's boring, it's the patient case that's boring, right? If your person is a very textbook classic patient with, let's say, breast cancer. I'm going to pick on breast cancer not because it's not a good diagnosis to cover, it's just because it's one of the more common diagnoses I see. So in this case, if you have selected a patient case, or you're thinking about a patient case who is super textbook, right? They were diagnosed when they were in their, 60s, right? And they had a pretty uncomplicated progress through their treatment, and now they're on the other side and they've got a couple things going wrong as far as they're experiencing some side effects and impairments, but everything is good and there were no complications and everything was just kind of perfect. Even as I'm saying that now, I'm sure you've already tuned me out. I'm sure you're already bored of me talking about that. Let me be clear. Breast cancer is not a boring diagnosis to cover. If you are thinking about a patient case of a person who has breast cancer, cool. What are the unique components of that case report, of that patient case, that demonstrate your expertise, your expert level decision-making skills as a cancer rehab specialist, right? What were the impairments? Maybe what were some of the unforeseen challenges or developments that came about as a result of working with this patient? So the patient case that I chose for my particular case report several years ago when I did mine is I was working with a patient who was diagnosed with multiple myeloma. And what was interesting about that, because I've treated other patients for multiple myeloma previously, but what was unique about this patient case is that I was seeing this patient a few weeks after diagnosis. We had started chemotherapy, but we're then going to be working towards a hematopoietic stem cell transplant. And so this concept of, it wasn't a true prehab, right? I didn't get to see this patient before they started chemotherapy, but I did get to see them before they went through their hematopoietic stem cell transplant and all the different side effects that we know can happen as a result of the hematopoietic stem cell transplant process. So the spin, and it's not even a spin because I think sometimes spin sounds like slimy, but the approach and the emphasis that I really chose to highlight in my own case report was this prehab process of working with this patient as he was going through his initial chemotherapy in preparation for his hematopoietic stem cell transplant. And that is what I spent my time on. I don't think I actually included any of, because I did see him after the transplant. I don't think I actually included any of that information. I just included physically how he progressed, how we helped to make him stronger during that time pre-transplant. Now, there were some challenges. This was not a perfect case. So, for example, my patient had a DVT, which was a real bummer. Within, I think, the first month of working with this patient. And then a few months later, this patient also had a new pathological fracture of his lumbar spine. This was after he was already experiencing some of these issues. That was part of his whole diagnosis process. Anyways, I digress. But I tell you this to show you that this was not a perfect, clean patient case where everything went right, and I came out of it looking like a perfect expert onco PT. That is not at all the case. But generally, this case does a really good job of showing what I picked that was really good for this patient and the results that we eventually saw. And then, most importantly, at the end, what I learned from that process and ultimately what I'm going to do differently, better, moving forward for my patients who come to see me for a prehab experience leading up to their hematopoietic stem cell transplant, okay? Again, this is just an example of, it's not that we're looking for the most, I say we, I'm not a grader, I don't actually know this, but based on what I do know about this whole process, we're not looking for the most perfect case report where everything goes right and you do everything by the book and everything is classically textbook and there's a happy ending for all. That is not the case. If you are looking for more specific information on how to pick a really, really good patient case for your case report, I would really encourage you. I have a free webinar that I'm hosting on September 13th at 7 p.m. Central Time called How to Start and Finish Your ABPTS Application by the Deadline. So this is a workshop that I have done previously, but I have done a special twist on it specifically for if you are in this boat right now. You are trying to get your case report done by the September 30th deadline. You know that time is short. You know you need to get it done. You want to get it done, but you're kind of like, I don't know how to get it done and write a good case report. This free workshop is exactly for you. Like I said, I'm hosting it September 13th at 7 p.m. Central Time. You can register for that free webinar that I'm hosting on September 13th at theoncopt.com/ABPTS. Again, that's theoncopt.com/ABPTS. I'm going to walk you through my process of what to focus on in your application, how to select a really good patient case so that you can get started with your case report and actually move on from that. And then ultimately, what are some of the common pitfalls that people make when it comes to submitting for the oncology exam in this whole ABPTS application process. So make sure to register for that. Like I said, it is free and you are really going to love it, especially if you are feeling the crunch of how am I going to get this done before the deadline, right? I got you taken care of. Next question. Do I need to indicate patient consent in the body of the case report? As a part of this case report writing process, there is a time and place where you need to indicate patient consent for writing about this patient case, right? As you are writing your case report, and you are choosing to include certain personal information in the case report. And that information I'm not going to go over in this podcast episode, otherwise we would be here for probably like another 30 minutes. That is located in the ABPTS candidate guide under the oncology section specifically in the case report stuff. Really, really encourage you, check that out because it very, very explicitly goes through what kind of information needs to be either de-identified, or if you do include that information, you need to have very, very specific patient consent and like a patient consent form signed and included when you submit your case report. Now, I chose to do the completely de-identified method when it came to writing my patient case. And I would really encourage you to do that. It makes it so much easier. Like, yeah, I had to go through and just make sure I wasn't using any, obviously like personal information. But that process versus having to track down that patient, especially since I'm trying to think my timeline here. I no longer was working at that position when I officially left when I was writing my case report and finishing it. And so that was the method that I chose to do. Like I said, I think it is the easiest to not have to track down the patient, especially if you're in a position where maybe your patient has passed. Maybe they are no longer actually alive to sign that form. Just de-identify it. And again, I will go ahead and link to that candidate guide so you can find that information under the oncology section under the case report heading. So that's kind of the general, does your patient consent to using this information in your case report. But what about consent when it comes to when I was treating that patient, did they consent to me actually giving treatment to them? It's probably not a bad idea when you are first going through the narrative of your case to indicate in the evaluation that patient consented to proceeding with evaluation and treatment for XYZ condition. It's not a bad thing. I do not think that is actually a specific requirement when it comes to your case report writing, but it's probably good practice. And if that's something that you're kind of on the fence of do I not, go ahead and include it and then just save yourself any potential frustration or concern later on. So again, that is general kind of patient case from both, can I use this patient case in my case report? And then did the patient actually consent to the plan of care that we put into place? That's kind of my answer on that. Next question is, do I list the rationale for every examination technique or just a few? I would encourage you, list them for each. And it doesn't necessarily have to be a whole paragraph as to why you're choosing to. But part of the case report is demonstrating that you are indeed the expert, right? You have expert level clinical decision making. And part of that is demonstrating that there was a very good reason for why I picked this particular, questionnaire, or again, insert examination technique here. The readers want to know that. They want to know that you have very specific reasoning for why you picked certain things and then why you picked those things versus other things. So for example, some of the things that I picked when I was working with my patient, again, my patient case, multiple myeloma, prehab for hematopoietic stem cell transplant, we did that's what it was. We did a timed up and go, even though I don't necessarily, at least at the time, I didn't have a specific, article that supported the use of TUG with multiple myeloma. However, what I did use for rationale is that is a very well documented and supported outcome measure when it comes to like balance and some mobility in some diagnoses when it comes to oncology. And so it was appropriate for use in this particular patient. I wanted to use the 6-minute walk test because, again, looking at general mobility in the oncology patient population, that is a very well documented, supported, and frankly, clinically feasible test for a lot of different reasons. However, for my particular patient, we did the TUG, and that patient was so wiped and in pretty increased pain after that it was not a good idea to move forward with the 6-minute walk test. And so that was actually something that I talked about in my case report of, I wish I had done this, but I didn't because my patient wasn't able to tolerate it. Another thing to consider here is that you don't necessarily, say you're looking back on this case now, and you're thinking to yourself, I wish I had done that instead because I know better now. Or I just wasn't thinking about it. That is okay. There is a place in your case report, so thinking more discussion, post-case reflection, where you can include that information, right? But when it comes to why did you pick the specific examination techniques that you did for this patient in your eval or whatever, whenever you were doing them with your patient, talk about it. And again, maybe there's a specific resource like the ABPTS Oncology annotated task, EDGE Task Force annotated bibliography. Maybe that outcome measure is really well supported with that. Awesome. Great. Maybe you pick a particular test because it is very easy to administer clinically and was appropriate for getting the results that you needed to determine more information about your patient. That is appropriate. I would encourage you, I would rationalize, list the rationale for each examination technique. It doesn't need to be a paragraph for each of them. It can be brief. Just explain why you used whatever you did, right? How does this support your expert level clinical decision making for this patient population? Next up, do I need to include each therapy session in the timeline, or should that be included in the outcome section? I have a rough timeline that goes from point of diagnosis to the end of plan of care, but I'm not really sure what to do there. So perfect. So let's kind of break this down. Do I need to include each therapy session in my timeline of the episodes of plan of care? So in your case report, you do have to have some kind of a timeline. Usually that is a graphic, like a table or a figure that graphically, visually demonstrates what was the plan of care for this patient generally. Mine, I did not include every therapy session, and I would really encourage you not to because that's not necessarily beneficial information. What I did in my own case report is I went month by month. So for me, my patient was diagnosed in, let's say month 1. And I'm not going to tell you what that month was because that might be a little too much information, but I did include the specific month in my case report. So let's say This person was diagnosed in May. Let's go with that. That's not actually the case, but that's what I'm going to tell you. So this patient was diagnosed in May. This patient was hospitalized in May. Patient was discharged from the hospital. Patient began chemotherapy in May. Okay, so that's the brief highlights of what happened in month 1 of treatment for this patient. Month 2, so June in this case, the patient was referred to PT. And then, if I'm remembering correctly, that's actually the same month that my person had a DVT. So I included that. Okay. Now, the DVT is relevant because the oncologist put my patient on a hold from physical therapy. Am I putting every single visit on the timeline? No, I'm putting the highlights of what is pertinent to my plan of care as the physical therapist, but also medically what's happening with this patient. So I think one of the other things I put on my timeline was when my patient experienced another pathological fracture. I think that was put on there. There was one point where we actually discontinued care. We put a pause in it because my patient had basically reached their ceiling with the TLSO that they were in at the time. And we knew that at some point my patient would be discharged from the TLSO, and my patient was very compliant with their home exercise program. So we said, let's save your insurance visits. Here's your home program. Call me when your TLSO is discontinued, and then we will ramp up from there, which is exactly what happened. So again, highlights need to go in the timeline section. Do not list every single, please don't list every single session that you have in that graphic, because otherwise that graphic is going to be like 3 pages long, depending on how long you saw that patient. The flip side, or the part B of this question is, should I include every session in the outcome section? I would not do that either. Again, I would tend to look at it as more of a, like, when you did a reevaluation on that patient, when you discharged that patient, if you did indeed discharge that patient. With the outcomes, I want you to zoom out and kind of look big picture here. What did you ultimately accomplish? What kind of progress did you make with that patient? What were the eventual, results of you working with that patient? Good question. Ooh, here's one. The provided case report in the candidate guide lists the therapy goals specifically. Is this necessary? So question is, do you need to list specifically the therapy goals that you created in your case report? My answer is no. Now, I did, however, include the general overarching goals that I wanted my patient to get to. So for example, my patient really wanted to get back to exercising. My patient had a grandchild on the way, and so wanted to be able to actually lift and hold that grandchild, and wanted to be able to travel, tolerate travel to go see that grandchild. So that was something that we talked about as big picture. Those were some of the goals that we were working on, but I didn't actually include the very, very specific goals that I was working towards in my plan of care, because they did tend to change pretty frequently. Like, there were some times where my patient was making good progress and we were like blasting through our goals really quickly. There were other times where some of our goals didn't get met for much longer because of some of the complications that we experienced along the way. Again, that's okay. The case report isn't designed to see how perfect of a clinician you are, but with your goals, zoom out, look big picture. What were some of the things you were trying to accomplish, and why was that so important for your patient? Okay, last question here. I used first person when writing some sections, like the case rationale and my rationale for choosing testing techniques. Is that okay? As someone, me, who is not involved in the grading process, I have no role whatsoever when it comes to grading case reports for ABPTS. Here's my thoughts on that. So that's my little disclaimer. I believe this is okay. I literally went through this morning, as of the time of this recording, and looked through the candidate guide in the oncology case report section. And there was nothing in there that stated, do not use first person, or only use third person when writing this. when it comes to the case reflections and the rationale, it makes sense that you could use first person to discuss why you chose certain things. And I don't think that is a problem. And in fact, when I wrote my case report a few years ago, in the post-case reflections, I did insert some information about, now that I know this, or, moving forward, if I were to see this patient again, I would use this. And I think that's okay. Now, I will be the first to take that back if I learn otherwise, and I will do an addendum, I will make corrections, whatever are needed, but based on the information that has been currently published by ABPTS surrounding the oncology case report, there is nothing that says you cannot use first person. If you find out otherwise, kindly let me know, because I would love to pass on that information to y'all, of course, so that you have the most updated information to write the best case report possible. Now, again, if you have listened to all of this and you're thinking, ooh, I'm still a little nervous, I don't know if I have everything, I don't know if I'm going to be able to submit my case report and finish it by the deadline, I don't even know where to start, that is okay, friend. Because remember, I am hosting a free webinar on September 30th, that's the deadline, on September 13th, which is before the deadline, on how to start and finish your ABPTS application by the deadline. So we are specifically I am teaching this live, and we are targeting this information particularly for the upcoming September 30th deadline for the application and your case report. And I am going to actually share with you, as a bonus as part of this experience, I am going to provide you with information on how you can actually finish your case report by the deadline, even if you started on September 13th. I will show you my method for how to finish your case report in 14 days. It is not historically what I recommend, but I also recognize, as someone, I'm raising my hand. If you're not watching this on YouTube, you probably can't see me raising my hand right now. As someone who waited until the absolute possible minute to submit their case report, I've been there, friend. I know why, right? I know why sometimes we get so hung up on writing the case report and finishing it. I get it. I've been there. I've done it. And I am breaking down my exact method for how to finish your case report by the September 30th deadline, even if you don't start until September 13th, which is when my free webinar is taking place. Again, you can register for that at theoncopt.com/ABPTS, and I will see you at that webinar. Until then, this is Elise with the OncoPT. And remember, you are exactly the physical therapist that your patients with cancer need. So let's get to work.